Hi, my name is Dr. Joyce Alberts, clinical psychologist. I work in private practice based in North Canterbury, New Zealand. I've been posting a series of videos relating to different issues which have caught my attention, specifically the vulnerability of women and children when they're in situations where other people are making decisions about their health, their well-being, where they live, how they dress, etc. I've done a series of videos which I soon hope to soon update on the tragic death of John O'Keefe and the subsequent trials of his girlfriend Karen Reid. I've also done a series of videos on a high control religious group here in New Zealand, referred to as the Goravale Christian Community. But more recently, I've posted two videos so far on a trial which is being conducted in the United States of America in Massachusetts. And this is the trial of Lindsay Clancy. And Lindsay Clancy has been accused by the prosecution and charged with causing the tragic loss of her three children. The defence is arguing that due to a combination of postpartum depression alongside with uh, multiple medications that she is prescribed by more than one mental health service provider, and then the onset of a psychotic episode, that she should not be found guilty due to those factors. The trial is finished for this week. So in the United States, the day 13 of the trial was on their Thursday, which was the early hours of this morning. I did make a bit of a sacrifice and started to watch the trial live just after, I think it was just after 2 a.m. I didn't stay fully awake for all of it, but I did follow attorney Melanie Little's live content until that finished this morning. I may have been a little bit behind the live feed, but again, it was very interesting. I'm going to touch on some of the evidence that was brought before the court yesterday. Uh, so that would have been day 12 of the trial. So that would have been on Wednesday, the 12th of August. We are in August, yes, 12th of August in the United States. It was a very, very heavy, distressing day. I wouldn't even want to go in depth by showing videos or even reading the transcripts. It was harrowing, and not just for those observing, but apparently for those that were in the court. It was very distressing for members of the jury and extremely distressing for Lindsay Clancy. And I'm going to touch on that at the end of this video. But before I launch in, there is one thing I do need to clear up. I think I had a bit of a brain glitch the other day when I posted a video called that's titled "Continued Review of the Evidence Presented in the Lindsay Clancy Trial," and I got myself a little bit confused, having listened to this trial now for 13 days, and I've heard them refer to the American pronunciation of the Edinburgh postnatal depression scale. And then I was like, no, I'm pretty sure that's Edinburgh, which Edinburgh is a city in Scotland. And then as I'm saying this on my video, I look across at my screen and I see how it's spelled. And I got really caught up again in the American pronunciation of Edinburgh and thought, well, maybe I'm confused. Maybe it isn't the Edinburgh um, place in Scotland. And then I've gone back again and I've had a look, and it does appear that the Edinburgh postnatal depression scale, the correct pronunciation would be Edinburgh. So even though it's, and I can actually share screen, and I will bring that up and I will show how it's spelled. I've brought up another version of the Edinburgh postnatal depression scale. So I will just show you that. and you'll see again the way it's spelt is uh, being Scottish and Gaelic. It's not the way. Is that sharing? Okay, looks like it is sharing. So here you can see it here. The Edinburgh Postnatal Depression Scale. This is a different version of it from the one I did show the other day. It does give free permission to use as long as the correct reference to the developers of the scale and credit is given to them. And you can see here the spelling of it. So the American pronunciation has been Edinburgh, but should be pronounced Edinburgh. Okay, so I gave more information about that scale, its utility, and that it is a common scale to use. Now, there's been a bit of snark that's come through around this scale saying, well, it's free and so it doesn't cost much. So that's why our providers are using it. But the main important for myself as a clinician and why I would choose to use the scale if I didn't have anything else available that was also developed specifically to assess for postnatal depression. And while it says postnatal, it could also be during the whole perinatal period. So you could use a scale to monitor an at-risk woman during her pregnancy, post-birth, and then through the treatment process. So whereas the other scales that are developed are often developed using a sample size which is more related to the demographic population, a variety of age groups using both male and females. And in this case, quite logically, I don't want to compare, if I had a woman complete the scale, I wouldn't want to compare her results, say, with a male who's experiencing depression, because the mere fact that there's a whole convoluted, complex interaction between hormones, stress levels, etc. This is something that, say, a 13-year-old girl may not necessarily experience, and logically, a 28-year-old male or a 35-year-old male, or even a post-menopause woman may not experience. So this scale has been specifically developed, and the research around its validity and reliability indicate that it is sensitive, has sufficient sensitivity to detect and identify women who are at risk or who are showing significant symptom levels that, along with other information, may assist in making a diagnosis. Okay, and there's one more thing that I just do want to talk about before I launch in, and it was one of my other videos that I was talking about the what beef tallow, and this is a New Zealand product. And I think in that video, whether it was a brain glitch, because I'm sort of wondering about what's going on here, because it happened a number of times in the video where I said someone's surname, and then when I watched the video back, the surname had been came out as Reed. It's possible that because I was doing videos around Karen Reed, I'm thinking a lot about Karen Reed, that when I said attorney Melanie Little, which is what I meant to say, it may have come out as Melanie Reed, but I certainly meant attorney Melanie Little. So she has been talking about the wit tallow, and I looked at the particular brand that she was referencing, and I thought, well, yes, I could purchase that and have it sent to me from the United States. But then I had a look at whether there is a comparable product here in New Zealand, and I came across this one, which you can purchase online. And this is, it comes from a company called Primal Pantry, and it is, the one I've been using is the Manuka honey and vanilla. And I've just been blown away by this. It's a fantastic product. I've been using this now every day, 2 or 3 times a day. I use it on my face. I used to use it on my hands or any other places that my body may feel dry. It's been endorsed by the Eczema Association, so apparently it's very, very good for severe eczema. So then I went on to their site and had a look at what other products, and I don't have them all here. I'm not sponsored by them, but I'm just going to give them a shout out. So they do this gorgeous berry crush, and it's a lip and cheek tint, and it is also the base of this is tallow, beef tallow. I've also purchased their shampoo and conditioner. So yes, you can also buy a shampoo and conditioner, and I'm just going to give you a heads up. I am going to the hairdresser today, so the next time I do a video and they look a bit different, I have not been to the hairdresser for months and months and months. The best hairdresser in the world, Jodie. Also, along with, I'm just thinking what other products. Yes, so the Primal Pantry. The other product that I've also purchased is the under eye cream, and that just feels absolutely divine. It's a lot lighter than the whipped beef tallow for face and body, which is more of a thicker cream base, and so the under eye cream is very light. You can just pat it in there, and it just feels wonderful. I will use the beef tallow face and body during the day if I feel particularly dry, especially with hay fever. Here in New Zealand, we're right in the middle of, well, at the beginning of the pollen season. So the radiatus pinus are releasing the yellow pollen. So there's a cloud of yellow pollen on the ground. If you park in a car park, you're going to get it on your vehicle. Where I live, we're close to a number of different forestry plantations, and apparently I'm allergic to just about any yellow pollen. So this time of year, I may get really weepy eyes. I haven't been outside as yet, but I know as soon as I step outside, my eyes are going to start weeping. So by the end of the day or around lunchtime, because I'm wiping my eyes a lot, they sort of feel yuck. So then I might use the face and body cream rather than the under eye because it's a little thicker. Okay, so that's the end of my shout out to the Primal Pantry, the face and body balm. This is the beef whipped tallow, and it is the one I like is the Manuka honey. Here in New Zealand, our Manuka honey and products that contain Manuka honey are just the world leaders. So I've chosen the Manuka honey and vanilla. It has three products in this, three ingredients, I should say, in this product. Not surprisingly, grass-fed New Zealand beef tallow that also contains organic jojoba oil, Manuka honey, and vanilla essential oil. So that's four products. Sorry, if I said three, that's four. So the beef tallow, jojoba oil, Manuka honey, and vanilla essential oil. Wonderful. Give it a try. It is cost effective, and it arrives, if you're living in New Zealand, it arrives very, very quickly. You don't have to wait too long. So let's go back to Lindsay Clancy. So I just want to talk about why yesterday's trial, day 12, was so harrowing. So first of all, if you haven't been following this particular case, the defence, so the barrister who is defending, or the attorney, as they're referred to in the United States, defending Lindsay Clancy, had offered to the prosecution to stipulate or have an agreement, so agree that the evidence will confirm that Lindsay Clancy was responsible for the tragic loss of her children. And by making that agreement, they could then move to the phase of focusing on whether, even though she's admitted that she has done that, whether because of her mental status at the time of this tragedy, that she was not guilty due to insanity. However, and that would also mean that a lot of the harrowing evidence and testimony of people like the first responders who arrived on the scene, the medical examiner, the pathologist, um, information around the autopsies, etc., would not need to be presented to the jury. These are very young, three very young children, and to go through that obviously would be distressing. However, the prosecution decided or chose not to agree to the stipulation. They have pushed forward to do the full trial. So that is to prove, attempt to prove beyond reasonable doubt that Lindsay Clancy did indeed cause the tragic loss of these children. They also are arguing that she did this willfully, that she planned this, she did this because she wanted to, she was tired of her life and she wanted a different life. In fact, I shouldn't even say what they're trying to prove because it is really confusing. And I'll get to that in a minute. So they've pushed forward with a full trial. And while at the beginning of the trial, you think this will be where they bring in that evidence, bring in the witnesses to present to the jury their assertion that beyond reasonable doubt, Lindsay Clancy did indeed cause the loss of life for these children, which they did do. And then on day 12, and this is they brought in some more evidence, which was really confusing because they presented it at the beginning of the trial, and then they've been bringing in some really unusual witnesses. So, for example, Lindsay and her husband Patrick belonged to a gym, a recreation centre where you could play tennis. There was a gym where you could do weights, Pilates classes, etc. But it was also a place where you could bring your children. So they provided daycare. They provided had a facility where they would run a program for the children. So parents who were going to come to the gym or the tennis club, they could drop off the children to the children's program area and then go and do their workout or play a game of tennis or whatever else they were going to do in the other parts of the facility. So the prosecution flew in from Texas. So remember, this trial is in Massachusetts, which is on the east coast of America, and Texas is closer to the west coast. So if I visualize the map of the USA, you have California and Texas, New Mexico, then there's the southern states, you've got Florida, South Carolina, North Carolina, and then moving up into the Massachusetts area. Don't quote me verbatim, but have a look at the map yourself. So there's a lot of distance between. And so this woman who had been working at this club and had been putting together the children's program, she'd obviously left the Massachusetts area and was now living in Texas. So the prosecution fly her in. And all she's asked are questions like, did you see Lindsay drop the children off? Did she bring the children to the program? What was the program? It had nothing to do with the issue, the key issue before the jury. And it was really confusing. Then they brought in a number of other witnesses who, on cross-examination, really effectively seemed to be witnesses for the defence. So witnesses such as friends of the Clancys, a married couple, they gave evidence. They weren't there. It was just, really confused why they're bringing all these witnesses. But the key witnesses they have been bringing in during this time have been the mental health providers who were caring for Lindsay Clancy from 15th of September through to the 23rd, sorry, the 15th of September 2022 to the 23rd of January 2023. So after days and days and days of all this other evidence, and it's gone so slowly, and the prosecutor, there's two attorneys who are leading the prosecution, they will often, after they've asked a question and the witness answers the question, they then repeat the answer as another question, or just repeat the answer. And it's just slowing everything down. A couple of times I have noticed that the witness has given an answer with some additional information, and then two or three questions later, one of the prosecutors will then ask a question which effectively has already been answered because that information is effectively now before the court. It will be in the transcript. And it's almost like I'm just not fully paying attention or listening. And so yesterday, they decided to bring in two experts, highly trained, highly qualified. One was the forensic medical examiner who completed the autopsies, and one was a specialist pathologist her area of expertise is in examining the brain and other organs such as eyes, etc., to help determine the cause of death. In fact, that was Dr. Stonebridge, and Dr. Stonebridge also gave evidence in the Karen Reid trial, which is really, really interesting. However, as you can imagine, this is related to three little children, and it just seems so unnecessary. And I'm not the only one who's scratching their head, going, "Why?" That's not being disputed. And in fact, in some of the cases where the attorney representing Lindsay Clancy has had very little cross-examination because they're not disputing those facts. They're accepting those facts. And it just seemed almost gratuitous to bring in these two highly qualified and respected medical examiners and pathologists to give this evidence, put up photographs. And apparently people in the court were really distressed. Members of the jury were, and not surprisingly, Lindsay Clancy herself was absolutely sobbing. So that was yesterday. So I want to go back a little bit further because I found some of the testimony that has been given, and I will. It does relate to day 12, but not what I've just spoken about. But this was one of the registered nurse practitioners who was providing the therapy, the cognitive behaviour therapy, to Lindsay. Now, I should have done my research on this, and I do apologise. I don't write a script for this. I just spend a bit of time thinking about what are the issues that caught my eye, and I'll do a little bit of research, and then sometimes a little bit of impulsive that way. And what was interesting and what caught my eye in this particular case, so even though I'm not quite 100% sure of the name of the service, again, it was a private practice mental health service where the practitioners in this particular service were focusing specifically on postnatal depression and the perinatal issues that women experience. My understanding is that Lindsay Clancy's mother-in-law, who knew one of the registered nurse practitioners, when they were both working also in a labour delivery unit as nurses at the time. So Lindsay Clancy's mother-in-law knew of this woman and knew of her practice, and strongly recommended that Lindsay go there. And so Lindsay made contact. She was initially seen by the clinical director, um, who did her initial assessment. And interestingly, in her evidence, when she was asked about whether that was in person or over Zoom, so remember, Dr. Tufts did all of her assessment of Lindsay over, I'm saying Zoom, that it could be another audiovisual platform. So she did it remotely. She didn't see her in person at all. But the clinical director of this particular practice said, no, I would not do the initial assessment interview with someone remotely. I need to see them in person in my office so that I can do the full assessment. Remember, I talked about that. I want to see their body. I want to see how they're sitting. I want to see how they walk in, and even see before they walk in how just what their manner is, how they present. Are they distressed, anxious, etc. Also, Dr. Patrice Berry, she said this in her own video as well, that as much as possible, we prefer to do face-to-face assessments and work therapeutically. And for myself too, especially once I have established the rapport with the client, that may be when I may be more comfortable to then move to uh, a remote format. And sometimes I do that when I'm traveling away and I need to see a client. We'll make time to do a Zoom call. As I'm not in my office, I might be in another part of New Zealand for work, and so therefore I catch up with clients that way. But these are clients that I've seen multiple times, face to face. My sessions go for 55, 60 minutes, sometimes longer. I don't have an alarm clock where, right, 60 minutes, time's up, you must leave. Sometimes clients are maybe a little distressed, and I want to make sure that when they leave my office, they can continue with their day, and we try to just decompress from some of that session, trying to bring them out from the middle of the session or those heavy parts to then just having a bit of a casual chat, asking what they're going to do for the rest of the day, etc. So let me go to this particular nurse practitioner. I'm going to briefly show a still. This is from it's called Courtroom Insider. I don't have permission to use their videos. I am getting permission from a number of YouTube panels that I can show videos. So Dr. Berry in particular. I've also reached out to a number of others and have yet to hear back from those. I'm sure they're all very busy. One in particular, the content creators for Hidden True Crime, Lauren Matthias. She's married to a clinical psychologist as well, and she's actually present in court, so she's very busy. Sure, she doesn't have time to read my email. So I'm going to show you the still, and this is from Courtroom Insider, which is East Idaho News, and Matt Ethan, and he has done a lot of content on a number of trials, including Lori Vella. That's a whole other one, which we might talk about at some time. Okay, as you've seen here, this is not a good freeze, but this is the nurse practitioner. So this is the nurse practitioner who was after Lindsay had initially been seen by the ex-colleague of her mother-in-law. She was the nurse who was going to carry on with the therapy. And you may see you may have noticed I've got the transcripts up on the other side of my screen here. So I'm just going to take you through some of her evidence. So after she's been introduced to the jury, they go through her qualifications and her experience, and then she's asked questions around her work that she's done with Lindsay Clancy. So remember, 15th of September 2022 is when Lindsay first saw Dr. Tufts, a psychiatrist in private practice, who began prescribing medication. Now, I understand it was late November of 2022 when she had an initial assessment with the clinical director of this practice, who at the time was in her last weeks working in that practice as she was shifting away from the area. She was returning to, I think, where she normally came from, maybe for retirement or a change, whatever. So that was planned. And it was explained to Lindsay that that was happening. So she was not going to continue with the therapeutic intervention and oversight. So this particular nurse starts to work with Lindsay, and she first sees her on the 2nd of December. So she's asked that question. So the question goes, in regards to on this particular first encounter on December 2nd, when it comes to the mental status exam, were you able to observe her facial expressions? Answer, yes. And what were your observations of her facial expressions? She was cheerful when discussing her anxiety symptoms. So that's the answer of the nurse. So she's cheerful when discussing her anxiety symptoms. That caught my attention, as I've never encountered a client who would be cheerfully talking about how anxious they are. Yeah, I was really anxious today and could hardly concentrate because I was just so anxious. It tends to be distressing. So that just made me scratch my head. So then she's asked, did you ask questions about Lindsay's thought content? Apparently she nodded her head, so she's reminded by the attorney, you have to answer out loud. She says yes. And she is asked, so what did she say about her thought content? This is the question is, what did Lindsay Clancy say about her thought content during this initial interview? The answer, so thought content, worry about her infant and that she had an addiction to Ativan. And that's a medication that had been prescribed. Actually, that's something I need to double check too. I wasn't sure whether it was a prescription medication or an over-the-counter medication that you can purchase at a pharmacy, but apparently it is prescribed. She's asked, so this nurse practitioner, did she do an assessment around SI or thoughts of self-deletion or harm? And it was phrased this way, and I've never heard that put this way. So apparently, one of the reasons that Lindsay was not admitted into a specific program similar to the Mothers and Babies unit here in Christchurch, I think it was called the Woman and Infant Service, was because she was over medicated. One of the reasons why she did not receive help when she rang a helpline on 2 occasions, potentially 2 occasions on the same day, which should have been alarming, that somebody is, saying, oh, I'm really, really distressed here. I've got these intrusive thoughts and I'm just really upset about this, because she didn't have any plans. And the prosecutor goes, no, she asked the question. It's this nurse practitioner who says what she reported as far as like passive thoughts were thoughts of not wanting to be here, no longer wanting to live, but no plan. Passive thoughts. Now, Lindsay Clancy herself has described these as intrusive and distressing, and I've never heard thoughts besides, described this way as passive. And she's asked, and is this significant to you? The fact that she identified there was no plan. Yes. Why was that significant? Answer: because if she identified that she in fact had a plan, then that would escalate me to see it as a crisis and request a higher level of support at that time. Now, it's been speculated by others, not myself, because I don't know enough about Lindsay and her circumstances, but that some people have speculated, well, because she did not want to stay in the inpatient service that was from the 1st of January to the 4th of 5th, and she wanted to be home with children, and being in hospital and being in these services is not a nice place to be, that she was not, maybe not fully disclosing that the SI and those thoughts had gone beyond thoughts to potential plans. Because otherwise she may have been compulsorily admitted to hospital under the Mental Health Act or the Mental Health Statute. So I'm just flicking through. So she's been examined by giving her evidence under direct examination from the attorney for the prosecution. And okay, just flicking through. Okay, so and that took just about, it would have been a good hour. Okay, so if you looked at YouTube, the clip that I've got, which is from Courtroom Insider, if you went to 54 minutes and 55 seconds, you see they've taken a break, the jury's come back in, they're now back in session, and the attorney for Lindsay Clancy stands up to cross-examine. So under cross-examination, the attorney is going to be trying to unpack some of not only the evidence that she has given, but maybe challenge her by presenting other information. So remember, she saw this particular nurse saw Lindsay on the 2nd of December for her first appointment, and it was on the 1st of January that Lindsay volunteered to be admitted into an inpatient unit. So she's asked, how many times did you meet with Lindsay? And her answer had been, it is 4 times. So tell me, is it 4 times that you yourself actually meet with Lindsay or more? Can you repeat that? So, sorry, the transcript doesn't show, then it's a break and it's someone else. So she's asked the question, and then the nurse says, can you repeat that? And she's asked again, is it 4 times that you actually met with Lindsay or more? And would that include telephone? So remember again, just about so many of these practitioners had not seen Lindsay in person, bar the clinical director who did her initial assessment. And her initial assessment sounds like it's similar to mine. It was an hour and a half compared to Dr. Tufts, who was less than an hour. So the answer is 4 times. So including the 2nd of December, 4 times. And you met her on the 12th of December, is that right? You met her on the 19th of December, is that right? And the 27th. Okay. Was there another one? Do you remember when that was? And then the nurse says, well, that was by phone. By phone? So would that be on the 27th? So yes. So the 27th was a phone call. And so when you met with Lindsay on the 2nd of December, were you able to look at the records of Nurse Paul as well as Nurse Gelato? So Nurse Paul was the nurse who I spoke about, but she was the registered nurse practitioner who prescribed medication, who met with Lindsay in person, and then the nurse Gelato was the nurse practitioner who was going to continue with the prescription oversight once Nurse Paul left. So she's asked, well, did you look at those records? Because they made their notes, and there's quite an in-depth intake or initial consultation that Nurse Paul did. And so did you look at the records of those 2 nurses who saw her prior to this nurse? And she goes, no. Oh, so Lindsay's attorney goes, oh, but you guys work in the same place though, right? And the nurse answers yes. Okay. So when a woman is in postpartum and comes to, I think it's the South Shore Health, the health, when you're trying to help them, you can't see the medical records from what other people like Nurse Paul and Nurse Galata have written down. My bad, your pronunciation wrong. Forgive me, I've got it wrong. So he's scratching his head going, what, you can't see them? You work in the same service, the same practice. And they saw her before you, prescribed medication, and she's obviously in quite a level of distress, and so you didn't read, you couldn't see them. And he says, yes, you can see the records. Okay, so you did look at the records. And she went, no, I did not look at them. And he's perplexed, going, okay, so on the 2nd of December, you can look at those records, but you chose not to. And the answer to that was yes. Later on, redirect, she says that the reason she didn't look at the previous notes or records that were obtained by Nurse Paul was because she wanted to come in with fresh eyes. And I was like, whoa, that's a little bit out there, because she's not doing an initial assessment. She's not undertaking the initial consultation where you get all the background history. And at the very least, you would want to skim over that. You would want to have an idea of who is this client? Who is it that I'm going to see? They've been seen by 2 other people in the service. So what have they noted? And then you may want to go back and compare, well, this is what I saw. Is it consistent or inconsistent? So she's asked around a lot of questions around that. And what was quite telling in terms of this particular nurse was she herself only saw her briefly, one in person, then the telehealth, and the last time she had contact with Lindsay, prior to Lindsay voluntarily admitting into an inpatient unit, was a telephone call. She's asked questions about, were you aware of why she was not seen in the specialist woman and infant service? She says no, she wasn't aware of the reason, but she was aware that she wasn't accepted, so they referred her again. Well, that seemed to be really critical, because the reason she was not accepted into that service was their concern that she was over medicated, and that the level of medication she was on needed to be reduced in order for her to be able to make best use of their program. So that would seem highly relevant to this nurse, who's not just doing the therapy, but she's also prescribing medication as well. She's also a registered nurse practitioner. And despite the concerns of the service, who they're saying, well, that's where you need to go to, they continue with the medication. And it's this lack of communication and coordination and discussing picking up the phone. And what was really upsetting for myself as a clinician was to hear that other service, so the woman and infant service, had attempted to make a telephone call to this service that this nurse works for to speak to the registered nurse practitioner who prescribed medication. They left a voice message, and that practitioner never replied, never returned the call. And apparently they attempted on more than one occasion and never heard back. And by the time all of that was sort of all comes to light, tragically it was all too late. So you've got one service prescribing medication, that a psychiatrist, Dr. Tufts, who's also prescribing medication. And then the specialist service who's saying, look, yes, we would like to work with this woman, but she's on too much medication and the levels of this medication is too high. And they reached out to this service who were currently prescribing, and I'm not sure if they knew about Dr. Taft's because the referral had come from this service, and they don't respond. Nor do they ring them and say, well, we referred her, how come she wasn't accepted? As a clinician myself, when I've been in a situation where I knew that a referral was going to go through to another service, and either before or afterwards, I would have a conversation. As a clinician working in private practice, when I've had a number of clients who the concerns for their mental well-being has escalated, I have remained with consent in contact with the mental health crisis team on more than one occasion with the acute services at our mental health service here, Hill Morton Hospital. Plus, on top of that, I was confused about all of this, and I don't know, obviously, because I don't work in the United States, I work here in New Zealand. But one of the limitations to confidentiality, well, the primary limitation, is when you're concerned that there is an immediate or imminent risk of harm to the person or to others. Now, this is a woman, Lindsay, who's saying, look, she can only sleep for 2 to 4 hours a night. Sometimes she's had 48 hours with little or no sleep. She's losing weight. In New Zealand, we are a metric country, so we use kilograms. The United States still seems to be predominantly imperial. So apparently she'd lost 10 pounds in the last month, which is a significant weight loss, and it should be one of those big alarm calls. She's also on a range of medication, quite, if you like, heavy medication, some of which are medications to help with sleep, to regulate mood or stabilize mood. She's been on medications that may be prescribed to people who are experiencing a psychotic break. She's on medications to sedate. And they're not talking to each other. And that should be a high risk factor. And as a clinician, as a sole clinician in my practice, if I know other services are involved, I immediately ask my clients for consent that I can have contact with those services. And that's when I deem it relevant. I don't necessarily have contact with a person's GP practice, for example, but especially if it's another service. In one case, a client, there was the acute mental health service from Hill Morton. There was a community-based service providing specialised treatment for issues that this client had. And unfortunately, was also our probation service, so Department of Correction, and then myself. And all four of us were aware of the work that each were doing and had consent from the client, and I was in communication via email. And these people weren't. And on top of that, when I have worked in a service where there are more than one person, and when I myself had a small team where I had someone who was working with the parents, and I had someone who was working more like working with youth, like a youth mentor, and then myself as a clinician. We also had a clinical nurse specialising in mental health who would come in on some of our cases, and we regularly got together as a team, if not every week, at least every second week. When I worked in outpatients in the hospital, we had a weekly outpatient meeting where we had all of the different therapists and clinicians, so social workers, speech language therapists, occupational therapists, physiotherapists, nurse, our psychiatrists, psychologists like myself, and we ensured that with a volume of patients, at least once a month, we would review that client's progress. At the initial intake of the client, and when we were concerned about the initial work we're doing, we might speak about them more often. Prior to accepting a client into the outpatient clinic, part of our weekly meeting, outpatient meeting, was that we would discuss new referrals. We would look at the information that was provided. If we felt it was insufficient, that referral, we might go back to the referrer and say, look, we actually need to know this, this, and this, and this. Do you have that information? Can you obtain that information? Or we decide that this person actually doesn't meet our criteria, and we may then go back to the referrer and suggest an alternative option. In some cases, we had clients where substance use and abuse was part of the picture, so we suggest that a community provider who addressed that would be a first point of call, and then once that was addressed and stabilised, then they would be suitable for our service. So there was a lot of liaison between the main hospital where patients may have been seen after a car accident or stroke, or they've had neurosurgery. There would be input and information between the two different hospitals, Christchurch Hospital being the main hospital where surgery is undertaken, and then Burwood Hospital, where I was working, was a rehabilitation, older persons rehabilitation hospital, where the spinal unit and brain injury were located. So it wasn't unusual for multiple communications, emails, even fax messages, telephone calls, or even physically going to those hospitals. It wasn't unusual for me. For myself and one of my colleagues, sometimes with a social worker, we would go into the ward, either in Christchurch Hospital or over to the acute inpatient service, and we might meet the person there or meet the team. There are also different community providers that myself and social worker might go to where the person was also receiving some support or services, and we'd meet with those people. So, and I appreciate that takes time and that would be costly for a private clinic, but there's ways and means you can do that. That might be where a video platform would be most appropriate. But I'm still scratching my head as to, and really astounded that this woman, Lindsay Clancy, was seeing multiple practitioners for months with acute symptoms that were indicative of a high risk for this woman. And the majority of the time she was seen over telehealth. And like, for example, Dr. Tufts, and I've been on about this, did not see her in person at all. All of her contact with Lindsay was by telehealth or through the message portal that they had for that service, where similar to like email or messenger. And Lindsay was making good use of that. But Lindsay was crying out for help. She goes to a private psychiatrist. She is recommended by her mother-in-law. Look, Nurse Paul is the one you want to see. Then she's referred to the women and infant service and tries, meets with them. And then she goes back to Dr. Tufts because she's saying, look, we need to address the medication. She rings a helpline. She voluntarily goes into an inpatient service. And there's one of the key things that I look for in clinicians, psychologists and psychiatrists we look for, is that sense of helplessness. And it would appear from the evidence that by January of 2023, that is what Lindsay Clancy was beginning to experience: hopelessness and helplessness. Hopelessness because despite her concerns around medication, despite even her husband's concerns, in fact, a phrase was used that he had said to some of the psychiatrists who were medicating his wife, "You're turning her into a zombie." she's so sedated. He just wanted her back. Lindsay herself said in a text message to her own mother, she said, "I can't wait to wake up and feel myself again." She's reaching out. She's trying to get help. She finds that she's basically not good enough to even get crisis help because she doesn't articulate a plan. She can't get accepted into the service because the medication's too high. And when she goes to see the psychiatrist and say, "Look, I'm not happy about these medications, they're not working, or the side effects," instead of reducing her medication and addressing that, they increase the medication. In fact, on the 23rd of January, the day before, Dr. Tufts had again increased one of the medications. And while the defence hasn't put on their case yet, I am just going to pause. My apologies, I just had someone unexpectedly arrive and knock on the door. I wasn't expecting that. So let's carry on. So I can't quite remember where I was up to. But I think I was having a big rant around my concern that as I've been listening to the evidence that has been presented as part of the prosecution's case, and this is astounding. The prosecution is bringing in this evidence, and these witnesses who, on cross-examination, almost appear to be witnesses for the defence. And I'm listening to this going, if this, and again, Lindsay Clancy is not my client, and I'm not assessing her, that would be inappropriate. But if I had a client who was in this situation, some of the statements that she is making to these various clinicians and the pattern of behaviour of reaching out, um, you know, trying to get help and assistance. Also remember that she asked her mum. I think both parents came down to help look after the children and support Lindsay. She's trying to do everything she can to address the situation, and this idea of the construct of a sense of helplessness or hopelessness does seem to be creeping in. So I'm just going to read this part of cross-examination. So again, this is the nurse. This is the third person in the practice. That I think it might be the North Shore perinatal mental health practice. So Nurse Paul does the intake, and then there's the other nurse, Gelato, beg your pardon, I should have checked that. And then this third nurse. So she sees it initially on the 2nd of December. So, all right. So on December 5th, again, you are meeting with her for therapeutic intervention, right? And the nurse says yes. This is the defence attorney. And on this occasion, she reported she had a difficult weekend, right? The nurse answers yes. Intrusive thoughts of wanting to self-delete, right? The nurse says yes. That she contacted the crisis support line, yes. And she met with one of their clinicians, right? Yes. And what happened when she met with that clinician? Answer. She met with a clinician virtually and was told that she did not meet the criteria for inpatient treatment due to the fact that she did not have a plan. So if she said, in addition to the fact that she'd been in counselling and therapy and seen psychiatrists and on medications for the past 3 months, whatever period that would be, and that she wanted to self-delete herself, didn't want to be here, couldn't care if she did, that she would have, if she said that she had a plan, they would help her. But because she didn't have a plan, they couldn't help her. Is that what she was told? Correct. And did they know they, to your knowledge, make any recommendations, or did they recommended that she attend a day program? Answer, yes. All right. And that person from Aspire then said he would send her patient resources, right? Answer, correct. So again, remember, she's reached out again to this crisis help. She gets seen virtually by a clinician who says, no, we can't help you because you don't have any plans. Sorry that you're thinking about it. Yeah, I'm sorry that you've been seeing a psychiatrist and what else is going here? So she's been in counselling and therapy, seen psychiatrists on medication for the past 3 months, but sorry, you don't meet our criteria because you really need to have a plan. Come back with a plan and then we'll help you. Oh, by the way, I'm going to send you some resources. Lindsay's attorney. But nothing ever happened. He never sent her anything. You did, but he never sent her any patient resources, if you know, not to my knowledge. Okay, so remember when she after this, she does have the inpatient care for 4 to 5 days. And that psychiatrist said, well, on discharge, she was given resources. What resources were those? She was given the website Psychology Today. She was given apparently a pamphlet and some crisis helplines. This is prior, so this is in December. They said, oh, we'll send you some resources. Sorry, we can't help you. Come back when you've got a plan, but we'll send you some resources. And they don't. But this nurse does, right? So she continues to see her. So the next time she was seen by this nurse was on the 12th of December. So on the 12th, right, remember all of the teleconference, telehealth, she's seen virtually, not seen in person. So now on December 12th, that was a teleconference, and she called in to have an appointment with you. Nurse, yes. Question, and at that point, she's reported that she'd had a difficult weekend and was experiencing intrusive thoughts, not passive thoughts, intrusive thoughts. And the answer is yes. Okay. So she's having a bit of trouble to find in her notes where this was. Okay. And it's put to this nurse that while she's talking about these intrusive thoughts, and she's had this difficult weekend trying to manage her anxiety and these intrusive thoughts, and it's put to this nurse, she probably had those beforehand. Have a look at references to the other interventions from other providers. And would you say that when she's talking about symptom management, and this is prior to the 12th, she's reporting that she's experienced intrusive thoughts, but she didn't have a plan, right? And then she contacted the crisis centre, right, over the weekend, right? And there were 2 times that she contacted them, not once, twice. Both times they told her there was nothing they could do for her. Yeah, that's correct. And so now you're going to start her on another medication, and you do that on December 20th, right? And in fact, you did that knowing that in order for you to be able to provide that particular treatment, you would you would then be going contrary to what the Women and Infants program had said, right, correct? And you wanted her in that program because it's a really good program, correct? And did you know that she did in fact go there on December 20th? And they turned her away because of the amount of medication. So on the very day, you continue to up her medication. And remember, when she, on her direct examination, she says, well, when she spoke with her, she was quite cheerful when she's speaking about her anxiety. And she's also got anxiety over these intrusive thoughts. But this nurse, it just blew my mind, as Melanie Melissa would say, my head popped off. And she's completely dismissive. And I may see if I can actually find a picture of it, because this was the body language. I'm not a body language expert, but this was really, really interesting. So I'll see if I can get the still picture again. Let me see. I want to see. I'm just having a look through different still pictures. I want to see if I can find it. Um, at one point, the Lindsay's attorney approaches the witness. I'll see if I can find it. And then stands next to her when she's sitting in the witness stand. Oh, I should have looked this up beforehand. I do apologise. And I might have to demonstrate the position. So the attorney's standing next to the witness stand. I'm still going to see if I can find it. And he's pointing something out to her. And, you know, even though he's quite some distance away, I don't think anyone would really say that he's invading her personal space. And I'm sure the judge wouldn't allow that as well. It's quite a large witness stand. I've certainly seen them sat in smaller witness stands. But she moves her entire body away from the attorney. And some people would say, I've heard some people suggest that the witness is recognizing that this attorney's questioning her in a way that's threatening to her, in the sense questioning her credibility, questioning her professionalism. I'm just seeing again if I can find it, because the attorney would have asked for consent to approach. I just can't find it. I can't find it. I might pull that up another day anyway. Because before approaching the witness stand, the attorney must ask for permission to approach. But that was really interesting. So remember that my whole point here is that this is again evidence of another service, another provider. This is my opinion. I believe it's still a free country to speak my opinion. They're letting her down. I think the number of times she saw anyone face to face can be counted on one hand. This is in the 3 or 4 months and sometimes twice a week, she was in contact with these clinicians, and more than one from more than one service. And the longest time she spent face to face was with Nurse Paul, and that was when Nurse Paul saw her around the end of November and did a 1.5 hour initial consultation. And for a nurse to provide, or anyone to provide therapy of this nature, at this level, with these risks, and to do that virtually, just, yep, blows my mind. So the theme that is around my particular videos and the series of videos I'm doing is around the particular risk and vulnerability to women and children when other people are making decisions. And in this case, it is psychiatrists and registered nurse mental health practitioners who are making decisions on, one, the risk and the severity of the risk to Lindsay Clancy, what medication she should or should not be on, what level of medication, whether they're going to consult with other providers, whether they even will read the notes of other people within your own service, let alone request information from other services. And that, in my opinion, increased the risk and contributed to the tragedy that occurred on the 24th of January 2023. As sad as this case is, it is a lesson to be learned. It's been informative for me as a clinician, for myself, to think about my own practice, reflect on that. How could I improve what I do and what I provide? But also to think about what are the factors that may increase risk. What are the things that I or other clinicians could do to help decrease risk? How could we coordinate services and what we provide in such a way to maximise the benefits for our clients? And also, while I do not have any information about this, I haven't looked into it in depth, but I'm really intrigued with the similarity between this case and the case here in New Zealand, and that's in relation to Lauren Dickerson. And her appeal will be heard in February of next year, February 2027. And I'm really going to be following that and see what information comes out of that. I'm really interested and intrigued to see what evidence is going to be put before for this appeal. So she's already been granted appeal, which means that her defence have already said, well, look, either this information wasn't considered or it wasn't presented. I'm not a legal expert here, but that's what I understand. So for an appeal to be granted, it must be based on new evidence that's not rehashing what's already been addressed in a trial. This is new evidence. So I'm really going to follow that one closely and see what comes out of that and what happens. But I am struck by the similarities of these two cases. And I'm wondering about the experience of Lauren Dickinson, what therapeutic input she saw, what help she sought, whether she did receive help. I'm wondering, I'm just curious because I don't know what medication she was on, whether anyone was monitoring her. And I appreciate the difficulty for Lauren is that her initial mental health issues were addressed in South Africa. She was seen there and prescribed medication there. And then she migrates to New Zealand. And very shortly after that, within 4 or 5 days of arriving in Timaru, the tragedy occurs. And again, that sense of a woman or anyone, but in this case, we are talking about women, a woman finding herself in a situation of increasing sense of hopelessness and helplessness, not being heard, not being listened to, not receiving the support, and losing that hope that things will improve. And in Lindsay's case, despite her repeatedly explaining her distress to clinicians, it was dismissed. When she expressed concerns for her medication, she was told, well, your depression's got worse. We can see that. You're more anxious than you were to begin with. We can see that. But that's not because of the medication. It's not medication effects. It's because you're depressed. You've got to accept that. You're depressed. And that's why you're going through what you're going through. And it's not unusual. We see this in other women who also go through postnatal depression, postpartum depression. Hey, you're not more special than me. And it just makes me so concerned about how much was missed. So I'm hoping that you find this helpful. For those that are watching, first of all, I do want to say too, thank you to a number of people who have subscribed over the last few weeks. Subscriptions have gone out now to, I do have 71 subscribers. The majority of those occurred a couple of years ago when I was posting some videos about my boxer, who we tragically lost 2 years ago. I also see that the number of people viewing these videos has increased. I apologise if you do find them too lengthy. I do tend to ramble on a bit. So thank you if you have watched these and taken the time to do that. More than happy if anyone wants to comment, and I am putting some hashtags in there to link these so that try to raise awareness. And if you do feel so inclined, if you want to like these videos or share these videos, because my intention here is to raise awareness, to have these conversations, to have clinicians like myself do some self-reflecting on our service and practices, but maybe to bring about some pressure to bring change. So for now, I want to thank you for your time and Aki.